Motivations with Glenn.
Good day, ladies and gentlemen. Thank you for tuning in to the Glenn Johnson Show, Motivations with Glenn and Apostle Jacqueline Cullins Wiliams, here on Awesome Radio, 107.5 FM, 1570 AM, WECU. Our topic of discussion, Breast Cancer Awareness 2025. There's a lot of things to be concerned about breast cancer, and I also want to mention it's just not concern females. It also concerns males. And there is also a triple negative breast cancer. It's THBC, I'm sorry. This thing is too far away. TNBC, triple negative breast cancer. T as a tango, N as in Nancy, B as in Bravo, C as in Charlie, triple negative breast cancer, TNBC. We'll get to those in a moment. Here's Apostle Jacqueline Cullins Wiliams.
Hey, Dr. Glenn, and to our listening audience on today. We are so glad that you tuned in for this awesome topic. And so we are so happy. I want to call it Pink Ribbon Month.
Yes.
Because Breast Cancer Awareness Month, the ribbon is pink for Breast Cancer Awareness Month. And a lot of people, need to be made aware of breast cancer month. I mean, especially females, that, you need to go at a certain age. It's recommended that you go and you get tested, you get the mammogram. And we want to give out some information. This is our first time talking about Breast Cancer Awareness Month. I know that we have Dr. Glenn, who is, he happens to be male, but today I'm glad that this is more of a female topic. Now, it's not exclusively, like Dr. Glenn said, because men can get breast cancer as well, but it's more common with women. And it's a great topic, sometimes when you start talking about breasts and those type of things, some people get, uncomfortable. It's an uncomfortable subject depending on how you look at it. But the truth of the matter is no matter how you look at it, it is definitely a health concern and an issue. And it's actually something very close to my heart, Dr. Glenn. And I'm going to tell you why.
I'm going to tell you why, too. It's very close to my heart. I'm going to tell you why. Do you want to know why?
I want to know why.
My sister-in-law is a survivor of breast cancer. When I found out she had breast cancer, I was still in recovery in Philadelphia at the nursing facility. When I found out about it, I was at the nursing station. They had to sit me in a wheelchair and wheel me back to my room. I was tore up from the floor up.
Oh, yes. And Dr. Glenn, I can understand being a survivor. I know some survivors that have survived more than one time. They have had breast cancer reoccurring more than one time. I know at least one person that survived it twice, and they're on their third time.
Really?
They're on their third time with breast cancer. And I also happen to have a sister who passed away from breast cancer.
Wow.
Undetected breast cancer. So
Undetected, yeah.
I want to say this, especially, and putting it out there, I'm just going to say it. Sometimes those that are in taken care of by state institutions and those type of things, those are, especially when they are adult IDD, those are the ones, and that was the case for my sister. She wasn't being taken care of or looked after in that way. Some people
In the early stages.
in the early stage, well, it was advanced.
Okay.
And they need to be going, and states need to be held accountable. Wasn't in this state, so let me just say that wasn't in North Carolina, but states need to be held accountable because there are annual exams that women, no matter if they're IDD or whatever, no matter what stage, they need to go and they need to be having them. And if they don't know how to do the breast exams, the doctors need to do them for them. And those are things that sometimes states, you have to check on your people. Make sure they're getting their physicals, make sure they're getting their care, and you have to look after them. I personally wasn't over this relative, so I could say that. But the ones that, and I didn't know, at the time that, things were being overlooked or missed.
All right, but you said the state should be held accountable, and I can't really fathom how you say the state can be made accountable when you say they have the annual exams and stuff. But sure, they have annual exams, but you can't make somebody go to the exam.
Yes, you cannot make them, but there should be a requirement. You can't make them, but when they're IDD, they're under the state's care. And they go for when they're sick, they go for other things, they take them. But the states need to be accountable. Sometimes those doctors are writing it down that the person went and they never even, or that they saw the patient and they never even saw them.
But here's the thing about my concern about you when you mentioned about the state should be accountable. The state can only be accountable if it's a law in the state that was passed by the legislature.
Well, what I'm saying about that is that when those people, the people that are being taken care of, they are under the same requirements that we are. There should be an annual exam. There's an annual this or annual that. I saw one case, Dr. Glenn, and we're getting down to 3 minutes before we go to our break. And when we come back, we're going to have you to do one of our audios. But I saw a case where the woman was disabled and she was being taken care of by the state. And she literally was pregnant and had a baby in the bed by herself. And this woman was not able to take care of herself. And there's a doctor that's saying he's seen her. They're supposed to be seen by a doctor. And I'm thinking that the people that were doing care with her there, they wasn't doing what they were supposed to do. How you didn't see a belly or see that this person was expecting a baby?
So if she was supposed to be seen by an OB-GYN.
Right,
I'm
but
only,
even her regular doctor.
wait a minute. I'm only saying OB-GYN because Steve Harvey made a mistake and said that. He mispronounced. Look at the lady's name tag. And everybody's like, Steve, that's OBGYN, obstetrics and gynecology. He said OB-GYN.
OB-GYN. Well, yes. Not that's not how you say it, but
Yeah,
there are requirements, to see the doctor, and they should see. And then the people that are taking care of them every day, how do you miss, that this person is expecting a baby? There should be some things that are written down that should happen every month, and it should be checked off in a box saying this happened or that didn't happen, and then you're taking care of them. Where don't you see a little weight? Don't you see a little something? There's some kind of change.
And I didn't mean to mention Steve Harvey's name, but it's in the public because it's on YouTube. And as far as I'm concerned, if it's on YouTube, it's a matter of the public. So
Well, and Steve Harvey could have been making a joke too about that.
No, he wasn't
so.
making a joke. It was actually live.
Wow.
Yeah.
Well, you could tell that he might need a little tutelage about women issues, and he does have a wife, so he shouldn't have been that
I
green.
know. He have a wife and all kinds of kids.
Daughters and everything. Yeah.
He
So
should have known it was OBGYN.
oh yes. So like I said, there are times when and I think in those cases where something happens and something has been overlooked, the state they need to be responsible and held responsible for that person that can't say to themselves, I need to go to the doctor, or can't check off a checklist and say it's time for my annual exam. When the state is in charge of them, they need to be held accountable when things are not looked after.
Well, can I make a suggestion?
Yes.
We'll have to see your name on the political ballot in the next coming election.
Well,
We have
hey,
to vote you in office.
well, they might have to get me up there, Dr. Glenn, because I believe in standing for the truth. And I must say that last week when we had the particular ballot, the particular political thing that was here for Awesome Radio,
Oh yeah,
and Awesome Radio was over. I was in attendance. I was sitting right there,
the
Dr. Glenn.
candidate forum.
Yeah, and I was putting up questions and stuff. I need to, when we come back from this particular break, I'm going to say something more about it because I feel like we need to, as a people, we need to get more involved. And I didn't see a lot of us there, being involved in what these political figures that we're allowing to run, certain stations, and we just have no say so. I don't feel like we were represented well there. And I feel like that's something we need to go forward with. Hey, we're getting ready to go out on our first break here, and we're going to ask that if you would like to call in and have something to say, you could call in. We're going to be right back with this break. This is the Glenn Johnson Show on Awesome Radio. Right back in a moment.
My name is Jayla, and you're to see to my papa, Glenn Johnson, on the radio.
Hello, my name is Daniel out of Greenville. Thank you for listening to Awesome Radio 107.5 FM, 1570 AM, WECU.
Welcome back, ladies and gentlemen, to the Glenn Johnson Show, Motivation with Glenn and Apostle Jacqueline Cullins Wiliams. As we're going out to the break, Apostle did mention if you have a comment or question, don't hesitate to call in rather. The number is 252-756-2008. You'll be live on the broadcast with us with your comment and question. Let me go to that first audio clip and let me check to see which one that is.
Dr. Glenn, you would let me finish that
Oh,
real
yeah,
quick.
go ahead. Yeah, go
I
ahead.
just want to say, that we need to be more involved. And, I have to say that I'm guilty too. I was there for, the political forum that we just had that was hosted by Awesome Radio. And I heard I heard the questions that were being asked to the political candidates that are being reelected, over this particular territory. And I heard the promises that were being made. I heard the things and the questions that were being asked. And I even posed a few questions myself and put them up there anonymously because I want to know, what is happening with homelessness and what these politicians plan to do. If you don't get out here, you don't even know what people have promised to do or what they've neglected to promise to do. And then you don't know when they're coming up for reelection if they kept their word concerning what they said in the last, election. So you need to get out there and see what is going on. A lot of times we don't even know the people. And I'm just telling you the truth, Dr. Glenn. I mean, I was out there just to see the mayor and this and that, and I was sitting up there and I had no clue. I don't know who these people were when I see them because we're not out here and we're not getting involved and we're not seeing what's going on. And we need to get up and we need to do better. We need to be aware. What if, these representatives, for our particular city here are sitting right next to you. You don't even know because you haven't met them. You don't know their faces. Get in and get involved is what I'm saying to, all of us, because the issues that affect us, we like to make some complaints, but we don't like to be up and be accountable for seeing about things or seeing how things are going or seeing what is done or what could be done or what we could be involved in helping to bring forward, for the help of other people. And I had to say that, Dr. Glenn.
That's interesting that you should say that because perhaps we should have another broadcast on our political figures, the continuity of government, local government, and county government. Who are our representatives? And what does it mean to have a county seat and so on and so forth? Do you even know what a county seat is?
What do you mean, Dr. Glenn?
The county seat.
A county seat as far as
No, let me explain what the county seat is.
Political arena?
Yeah, let me explain what the county seat is. So we're in Pitt County.
Yes.
Right. So all the Pitt County government offices are Greenville. So Greenville is the county seat. Like Raleigh, all the state offices in Raleigh. So Raleigh is the state seat.
Yes, I remember you saying that and explaining that the difference between what was going on in Winterville versus, Greenville.
Yeah, that was the property tax.
Yes.
Because Winterville, we pay not only the town of Winterville, but we pay the Pitt County tax tax administration for property tax also because the county provides things that Winterville does not. That's why we pay taxes in both the county and the town of Winterville.
Oh, yeah. So, Dr. Glenn,
Property tax it is.
I was very glad too to also see you there at this particular event that night. And Dr. Glenn was like a celebrity. He was in there just, he knows some of the people and he's waving and talking to some of them and they know him. But, I'm just getting introduced to that arena. And I remember being asked by an individual, like, well, who are you? And I almost said, I'm a child of the Most High King, the Most High God. I'm just, I'm a part of the station. And I did tell them that. But they did think I was one of the candidates or something.
But you had your ID, your nameplate on.
No, I didn't have anything on.
I thought you got it from the desk outside.
I didn't. I didn't even have anything on. But it's something about you sometimes you look like you need to be a politician. Maybe I will run at some point. I know that there didn't have to be education for a lot of these particular positions.
As a matter of fact, I just mentioned that name badge. And I just realized when I left the Greenville candidate form, I still had mine on and I took it home. And I know it's property of Awesome Radio, so it's out of my car. And I'll leave it here. Well, if I thought about it when Mr. Keith was here, I would have hit it into her hand.
Oh, yeah. Well, I didn't see mine or I didn't see my name anywhere because they probably didn't know if I was coming or not. Yeah. But I did enjoy and I stayed to the end to hear, what everyone said. And, the opposing candidates, which one promised to do what and what they were looking after each individual candidate and what they brought to the table.
And if I'm not mistaken, you're referring to the Greenville candidate form, and then the Greenville candidate form is one of the larger ones because of the number of representatives. And if I'm not mistaken, I think that went from 7 p.m. to almost 10 p.m.
Yes, it did. And the replay is on GPAT television.
Yeah,
so
GPAT
you can be accountable and go back and listen to hear what these representatives are saying.
Yeah.
And what they're promising to do and the issues that they addressed there on the forum.
All right, we got 3 minutes to go before we go to the second break. Let me play this 50-something second audio clip.
Hey friends, so let's talk about something important. I recently learned that the leading cause of cancer death among Hispanic women is breast cancer. And young women can get it too. In fact, 1 in 10 new breast cancers are found in women under 45. So let's talk about some warning signs and symptoms. You might know to be on the lookout for lumps, but breast cancer doesn't always present that way. You really need to look for any changes that aren't normal for you. Thickening or swelling of any part of the breast, pain, and redness can all be signs. Pay attention to any changes to the skin on your breast too. Think irritation, dimpling, redness, or flakiness. And any pulling in, pain, discharge, or flaky skin on the nipple, those are also signs to look out for. Again, it's really important to know how your breasts normally look and feel. And if you notice any changes, talk to your doctor right away. Lastly, learn about your family history of cancer and ask a doctor how it could affect your risk of breast cancer.
March is triple negative breast cancer month. And
in that audio clip, she mentioned something that was interesting. When she said, check for this and check for that, and not just a lump. And that also applied to males. Because I remember hearing that when they were talking about the males. Females are normally checking for lumps. But in the male, I think you got to check for other things as well. Like she said, soreness on your skin or around the nipple and all that kind of stuff. So
yeah, dimpling and flakiness, something that's out of the ordinary for you. Then you do need to talk to the doctor about it. And again, I say this again, Dr. Glenn, on the air, that if you're not sure, you feel some type of lump, don't act as if it's not there. Hey, we got a caller that's calling in right now. We're going to bring them on, and we may have to go to a break, but we're going to answer this call.
Caller, you are live on the air on the Glenn Johnson Show. You have a comment or question?
Hello, Glenn. It's Sharon.
Hey, Sharon. How are you?
How you doing? Good. How you doing?
Good. I'm glad you were able to get a chance to call in. You have a comment or a question? We have 1 minute before we go to the break.
Oh, I was just calling in, because it's breast cancer month.
Yes. Apostle Jackie, my co-host. This is my sister-in-law that I was talking about.
Oh, okay. It's nice meeting you.
Nice to meet you. How you doing?
Good. And we hear that you have victory over breast cancer.
Yes, yes.
I am so
Uh,
glad to
thir-
hear that.
13 years.
Yes, and
Oh,
listen, we're getting ready to go out on a break in a moment, but we want you to hang on this call because I need to hear more about your
Okay.
testimony because
Okay.
I just love it. I love to hear a positive testimony about it, and
yeah.
to have someone live on the radio
Mhm.
that's going to tell us that she overcame breast cancer.
And Sharon, I was telling her before you called in, when I first learned about it, I was just still in recovery from my accident in Philadelphia. I was at the nurse
Uh-huh.
facility when I found out. I was at the nurse's
Uh-huh.
station, and when I found out about it, they had to put me in a wheelchair and wheel me back to my room because I was tore up. I was, I
Uh-huh.
was, I was bawling all over the place. But we're about to go on a
Mhm.
break. Keep it locked right here, ladies and gentlemen, to Awesome Radio, to the Glenn Johnson Show. We'll be back momentarily. Back in a moment. Hang on, Sharon.
Hello,
Okay.
my name is Tracy, and you're listening to Awesome Radio 107.5 FM, 1570 AM, WECU Radio. Thank you.
Street preaching is a wonderful tool for spreading the gospel when it's done the right way. Stay tuned.
That's attorney David Gibbs Jr., and this is the Legal Alert.
We here at the Christian Law Association appreciate and adore the brave men who preach the vital news of the gospel on our city's streets. It's a time-honored, Christ-honoring practice, and we have defended this right constitutionally again and again. Great men like Billy Graham and D.L. Moody were street preachers. However, unfortunately, now we're receiving more calls of late from certain street preachers becoming a bit salty in their language, not polite. Their choice of words about people they disagree with are not good. This isn't wise and it isn't godly. It's so important to do the right thing the right way. Let me repeat that. It's so important to do the right thing the right way. And to do it the right way, let your speech always, as the Bible commands, be seasoned with grace. Street preaching is a protected constitutional right, but do it with the right spirit.
Our free newsletter addresses lots of issues, like the ones we've been discussing today. It's an invaluable tool. Why not sign up for it now at christianlaw.org. christianlaw.org.
We're back. You're listening to The Glenn Johnson Show. You can reach Glenn at glennjohnsonshow@gmail.com.
And we're back, ladies and gentlemen. You're still tuned into the Glenn Johnson Show, Motivations with Glenn and Apostle Jacqueline Cullins Wiliams. I believe we still have our call on the line. My sister-in-law calling from New Jersey. Sharon, are you still there?
I'm here.
Oh, great. Apostle Jackie, I think she still has a question or two for you.
Yeah, I would just like
Okay.
you to give us a real quick overview of how or your victory concerning breast cancer. I know that a lot of people, when they hear of a prognosis that could be potentially fatal or negative concerning their life,
Mhm.
the fear, start. A lot of times I think people, as soon as that declaration is made that you have this, that fear
Mhm.
overtakes them. And sometimes I think that ends up causing people to they die from it because they're so afraid of what could
Uh-huh.
happen and they're not ready
Mhm.
to fight or they've just given up because it's overwhelming. So tell us, how did you stay positive and hearing this prognosis and having the victory over, and I think you said 13 years.
Yeah.
13 years. I was actually, like around 40. It was I think my 41st birthday, and I was actually having chemotherapy. So, I also, work at a cancer center, so that helps a lot, talking to the patients. And then my mom my mom is also, a survivor. But when I first found out, I started crying, and the doctor told me right away. She said, "Okay, you're not going to die from this. We caught it early." So
Good, good. And
yeah.
Sharon, can I ask you? Because I think I recall, was this also around the time that you was in the process of becoming a paramedic?
No, no, no. I never became a paramedic. No,
I think you were in the process of becoming a paramedic at one time. I might be going a couple. I
no,
might be going years back.
no. I never did that.
Oh, I thought you did. Oh my God, I'm sorry.
Medical assistant.
Oh, medical
But
assistants. I knew it was something in
yeah.
that field.
Mhm.
That's even better.
And I went to my. Hmm.
That's even better. You went to what?
I went. Well, I found out. I went to my OBGYN, and he said, I'm gonna start doing your mammograms early because of your mother and your family history and stuff. And so that's how we found out. He started doing them early.
Oh wow, that's great. I didn't know that.
Mhm.
That's good. That's good. Apostle.
Mhm.
Yes. And so I see that one of the things that jumps out that you said, and you said it more than once, is that it was early detection.
Yes.
And so you
Mhm.
discovered it by a mammogram.
Yes. I just went to follow up with my OBGYN, and he wanted to start ordering them early.
Wow. And that is something that, that the ladies and women that are listening, to the broadcast now can understand that if
Mhm.
there's a history of breast cancer or any type of cancer in your family, you need to get those screenings early.
Yeah. Mhm. And they can also do genetic testing, and you can have that done, and get your
Yes.
mammograms. Go early.
Let me
And
ask
if
you a
you feel
question.
something,
Yeah, let me ask you a
hmm
question. So, does it specifically have to be an OBGYN, or
no,
could any
no,
medical doctor?
nope, your primary doctor can order it. Anybody can order it.
Okay, good. That's good to know.
Mhm. Yeah.
And that's exactly
So
who should order it with your, a lot of us, we have annual exam or an annual physical exam where
mhm,
they kind of put us down for a physical exam once a
mhm,
year.
mhm,
And
mhm.
that even if we're not sick, when you come up to a certain age, they'll recommend that you get
Yeah.
a mammogram.
Yes. Mhm. And your primary, when you go to see your primary doctor, they should be asking all these questions. I know mine does. So I get my colonoscopy done every 5 years. After you're diagnosed with cancer, they want you to have it done every 5 years. So I do all those things.
So, how often is it recommended for your scans after you've already had breast cancer?
Well, I do a mammogram every once a year. I alternate between mammograms and ultrasounds. I was alternating every 6 months between the MRIs, but I can't do that because the gadolinium, the dye, and when they inject it, it made me sick. So now I alternate between the mammograms and the ultrasounds, but it depends on the doctor. Sometimes they just do the mammos once a year.
Okay, that is usually what it is once
Mhm.
a year.
Now,
Uh huh.
the ultrasound. Which one did you have to take the dye for? The ultrasound
That's the MRI.
or the MRI? Okay. And you don't have to have
But
dye. You don't have to have dye for the MRI or the.
the MRI, you do the dye. The ultrasound, you don't.
And what about the mammogram?
The
No dye.
mammogram, no. Mm-mm.
No
No
dye.
dye. Yeah.
Okay, good.
Mhm. Yeah.
And
So
I
I
know
did.
that, a lot of times, and I just want to say this, that, mammograms are a little bit uncomfortable. I
But
definitely, between women, I've said that I know that machine was created by a man because apparently somebody didn't have any breasts. Because that thing, it does, you got to put your breasts in there, smash it like a
uh
pancake,
huh.
and then twist on them. I
Mhm.
personally, mine are
Mhm.
used to being together and they don't like being
Mhm.
separated.
Yeah.
so I can joke about it because I am a female,
Mhm.
but though a lot of
Uh-huh.
times people are afraid of it, it can be a little uncomfortable, that
Mhm.
machine.
Mhm.
that machine. So, getting it yearly. And I just want to say, don't be afraid of it. Because sometimes
Yeah.
I've heard ladies say they're afraid to go have one because of the testimony of other people. It can be uncomfortable, but it's
Yeah.
still the diagnostic benefits of it is just
Mhm.
awesome. You need to know that you don't have cancer.
Yeah.
Uh huh.
Now,
Mhm.
Sharon, we got 3 minutes before we go to the next break. Then we'll go out for about 10 seconds. Then we have
Okay.
two more 10-minute talk times. So I don't know if you want to stay with us or if you have to depart soon.
Oh, I can stay for a little while.
All right, good. So I'll let Apostle do the next 2 minutes. We'll go to the break for 10 seconds. Then we'll be back with our final 20 minutes.
Well, Miss Sharon, I
Okay.
just want to say, and I'm just so happy that you called in. I didn't know you were going to be on, and but I'm
Uh
so
huh.
glad, and I'm glad that I'm always prepared too,
Mhm.
to receive a good report, and
Uh huh.
I'm just very positive about this interaction because our viewers and our listeners can hear that it can be
Mhm.
done, that you can beat
Mhm.
breast cancer and you can live, and you have 13 years of a
Yeah.
testimony where you're breast cancer free.
That's right.
Mhm. Mhm.
That is
Yeah.
very, very powerful, for anybody that
Mhm.
needs to know. I like to throw people's name out and say, well,
Mhm.
Sharon beat it.
Uh huh.
God takes care of all of us lovely people, and she is such a
mhm.
lovely person, and
Thank
that's
you.
why God was in her corner always, always.
Oh, yeah. And thanking
Mhm.
him for his
Yeah.
grace and his mercy, because it's
Mhm.
because of him that we're not consumed.
That's right.
Yeah. Yep.
And so we're
That's
talking
true.
this year. And Dr. Glenn, I had it in front of me of what the slogan was for this year,
Yeah, I saw that. Yeah.
and
Mhm.
I've misplaced it. The
Well,
slogan
we
this
got
year.
we got 20 more minutes after this break in the next minute.
We'll find it. We'll definitely find it
Mhm.
because they did have a slogan out for this year for breast cancer, and we're going to give you a few things that are risk factors and things that are not risk factors for breast cancer.
Mhm.
Dr. Glenn's getting the paperwork together. Dr. Glenn, maybe when we come back from this break, you can do one of your audios there and
Yeah.
get it done. The
Mhm.
official theme is My Why. It says here for 2025, My Why.
Yeah,
Mhm.
when we come back from the break,
Mhm.
I'll do the one on the triple negative breast cancer. That's only
Mhm.
1 minute and 14 seconds. So when we come back from the break, I'll do the audio clip on triple negative breast cancer. Apostle.
Hey, we want you to hang on in there and listen and come
Mhm.
on. If you even want to go on our stream and send a question or something, even to our caller that's on, you could do so and we'll get it up there and we'll make sure that she gets your question. Hey, hang in there because we're coming right back after this break. The Glenn Johnson Show, Awesome Radio, right back.
Keep it locked right here to the Glenn Johnson Show.
I am Miss Mary Cox. I'm Killer Thigpen's mother from Awesome Radio.
Okay, that was real brief. Welcome back, ladies and gentlemen, to the Glenn Johnson Show, Motivation with Glenn. I'm going to go to the audio clip on triple negative breast cancer.
Dr. Conley, a lot of women have triple negative disease. We do know that triple negative can be aggressive and some of the treatments may not be as effective. Could you talk a little bit more about triple negative and the best way to treat triple negative disease?
So, triple negative breast cancer indicates a breast cancer that does not have one of the three targets that we look for. It does not have expression of the estrogen receptor, the progesterone receptor, or the HER2 receptor, and that is why it's called triple negative. And so we do not have the option of using some of our targeted therapies in those patients. Hormone therapy and HER2-directed therapies are not effective in triple negative breast cancer. Treatments that can be helpful include chemotherapy, and we have many different chemotherapy options that we can use for patients with triple negative breast cancer. Usually for a patient with early stage breast cancer who is going to have surgery, We use combination treatment strategies where we're using 2 or 3 chemotherapies sort of close together. In the stage 4 setting, we have multiple agents that we can use. We oftentimes use them one at a time, but we do have many chemotherapy options that we can use. However, we strongly encourage participation in clinical trials to get access to newer treatments that may be more effective as well.
It matters for women to know if they're at.
Okay, that was an audio clip on triple negative breast cancer. Our caller is still on the line. I have a question for Miss Sharon. So, my question is, once you're diagnosed with breast cancer, is chemotherapy the first treatment?
And I'm glad you asked that, Dr. Glenn, because that was going to be my question with her, was that did her healing come through chemotherapy or surgery?
Okay.
So when I did I had the option was to get radiation or to get the mastectomy, and I chose to skip radiation and go through with a mastectomy. And when I did that, they checked the lymph nodes, and that's where the cancer was in 2 lymph nodes. So I did the best thing by doing, having the mastectomy. So then after the surgery, they said, okay, so from what they can tell, they got everything. But at that time, what they did, they was offering the patients 4 rounds of chemotherapy just in case something is still there floating around that they can't see. So I did four treatments of chemotherapy.
Wow.
Mm-hmm.
Wow, so you actually did both. You did the surgery first and then the chemotherapy after as a preventative method.
Mhm. Mhm.
That is definitely was a process there to go through to be healed. But you did what you had to do.
Some people can just do radiation, and but some people need to do more. It depends on the type of cancer. It just depends.
Oh yes, and
and how far the stages.
Yes, I want to say to all of our listeners out there, and any of those that are newly getting the diagnosis of breast cancer, that you can live and you can have victory over it. And we send our prayers to you that you will be healed and made whole, and that you will walk in victory over it. And so even those women that are, because I know that it's a whole different arena after having the mastectomy, of things to deal with or things that you have to go through. Did you have to get any type of therapies, for, after, to help, with our mental state, or your mental state, after having the mastectomy?
No, I started going to with my doctor. You have classes and stuff, and I started going to the classes with the other women, ladies, but we really didn't have anything in common. And I said, I can't do this. They were complaining that they don't want to talk on the phone. They don't want to be bothered. They was housewives, and I'm like, okay, I gotta go back to work.
That's
I
right.
can't get a word in, so there's no point in me coming here. And I told my doctor, I'm not coming back. It's not helping me, So, like when the patients come in, I talk to the patients a lot. So, I mean, they tell me, about when they was diagnosed and how it happened. So I talk to the patients a lot, and they talk to me.
And Sharon, if you don't mind, can I tell you something that's not related?
Uh-huh.
Listen to your voice now. We're on another platform other than speaking in person, and I can hear your mom's voice in you for the first time. Certain words that you say, you sound just like your mom.
Everybody always say that. I found, when I'm home or she answers my phone, people can't tell us apart.
I know. I'm just noticing that. I never noticed that until now.
Mhm.
I can't wait to tell Simper later on.
Yeah, 'cause he sent me a message and told me, and I said, okay.
Yeah, I know. Yeah. Well, we got 3 more minutes before we go to the next and final break. Then we'll be back with our final 10 minutes. I'm gonna let the two ladies have the next 3 minutes.
And I wanted to say to Sharon, and I picked up when she said this, that she talked to the patients. And a lot of times, as women, that's what we need to do is to get in the
Mhm.
arena of someone that's going through something that we're
Mhm.
dealing with. And we pick up, I'm telling you, we pick up the best tidbits and wisdom, just by
Mhm.
talking about a thing or just,
Mhm.
word of mouth and find out what works for us versus
Mhm.
what other people say. We can
Mhm.
weed
And
out things and that we
yeah.
hear and say, well,
Mhm.
that's not working for me. And how you said
Mhm.
you couldn't go to those particular classes or therapies that the other ladies were in because they were
Uh-huh.
not in the same place that you were. You were ready to go back to work, and these were
Mhm.
housewives that were complaining,
Yeah.
about certain other things. So you have to find out what is good for you. Eat the meat and spit out the
Yeah.
bones is what we say. In the
Mhm.
church
Mhm.
realm, you have to find
Mhm.
out what works for you, and we'll ask somebody and start talking about it. Girl, do you know
Uh-huh.
this? And girl, do you know that?
Mhm.
And we'll be finding
Mhm.
out and get the best thing for ourselves. I love
Uh,
that.
uh, and a lot of patients come in and they'll show me like the plastic surgery. They'll show me the breast and how the doctor did, and we talk about that. And they like their plastic surgeon, and you can't tell the difference.
Oh, yes. That is awesome because, I
Mhm.
wanted to ask that, but I didn't want to be too personal,
Uh huh.
about it, or if I didn't know how personal you were about it. But I'm just saying for myself,
Oh no, I
if
talk about it.
I'm getting a new set.
Well, okay. So when I had my first surgery, they did the mastectomy, and they put something in called a tissue expander, and you have to wear that for a couple of months, and then you go back for the final implant. But the I caught an infection from the hospital, so that had to come out.
Oh,
So then I waited until I didn't get my second plastic surgery until 2018. So I wore prosthesis from 2012 to 2018.
and I do know some ladies, older ladies, that elect just to keep the prosthesis and they don't get any reconstructive surgery after, And I know
Uh-huh.
some. Hey, Sharon, we're getting ready to go out on a break again, and we're getting ready to go
Uh-huh.
out. This is our last break, and we're coming back to our last segment. But we want to ask
Okay.
our audience to hang on in there with us, that they'll come right back after this break, and we just going to have you to go ahead and hang on there. I'm going to have you to give some words of encouragement to our viewer. You've been on this long. So when we come back for that
Okay.
last break, we're going to have you just
Okay.
give a few words of encouragement to our
Okay.
audience on today, or to someone that may be going through breast
Mhm.
cancer or any type of cancer where they need treatment. Hey,
Mhm.
we'll be
Mhm.
right back from this
Okay.
break in a moment. We'll be right back. Awesome Radio.
My name is Jayla, and you're to see to my papa, Glenn Johnson, on the radio.
Welcome back, ladies and gentlemen. We have reached our final 10 minutes of today's broadcast on Brain Injury Awareness Month 2025. And we had a caller on the line with us, and I appreciate our caller calling in. But this is our final 10 minutes, so I'm going to give it right back to the two ladies for the next the last 10 minutes. Apostle Jackie.
Y- Yes, Dr. Glenn, and to our caller, Miss Sharon, I just want to tell you that I've enjoyed, having you
Mhm.
on and the things that you've said. And I just wanted to give over to you just for a few minutes. I know you wasn't scheduled for the interview, but hey, let's let you give a few. Dr. Glenn should have just asked you to come on, but hey, here you are.
Uh-huh.
Yeah,
Mhm.
I didn't know if she was going to be available. That's why I figured I'd just have her
Uh-huh.
call in. But you're right. I don't know if anybody else was trying to call in because the line has been busy. I should have gave her the other
Uh-huh.
number if I knew she was going to be on for this while. But it's all right now. It's done.
Yes. So, Miss Sharon, if you want to just take a few minutes and just encourage our audience on today, somebody listening may be very down or, may be discouraged about getting that diagnosis. I know, and I can hear it in your voice. I can hear such a good spirit on the inside of you. Can you just encourage somebody today that may be going through the very same thing?
Hmm. Oh, I think for me in the beginning it was like really, really, really depressing because when my mom came, she says, "Oh, why do you have to walk around and look like that? You won't put on no clothes. You just look like a bomb." I didn't want to do nothing, but then when I started, it was just a part of life, and you got to get up, and keep going, and keep your doctor's appointments. Go to your doctor. If you feel something, don't be scared. Go ask questions, and you just got to do it. Get up and do it.
And I love
It's
how you
scary,
talked
but
about your mother that just came and encouraged you, and she said, "Girl, you ain't putting on your clothes. You need to get up and get moving." That's how we do. We
uh
need
huh.
somebody that encourages us in our life, and thank God your mother was there to help you get up.
Mhm.
And
Mhm.
I know that if someone was close to you, because you were already poured into concerning that, you'd be able to pour
Mhm.
into somebody else and say, "Girl, don't be sitting around.
Mhm.
Get on up and let's
Mhm.
get busy."
Oh, that's right, 'cause her
Yeah.
mom don't play. Her mom don't play.
Mhm.
Get up, dress up, and show up.
That's right. That's right. Her mom don't play, and I know
I,
that.
I I don't know if Glenn, if you remember Yvonne. You remember Yvonne?
Yeah.
She went through it last year. I'm gonna see. I'm gonna ask her if she'll call in. What days? Is it Wednesdays? That only on Wednesdays,
Yeah, well, I'm on Wednesdays 3 to 4.
3 to 4. So I'll see if she could call in like next Wednesday.
That'd be fantastic. Maybe we'll do a part 2.
Yes, that's what I said,
Mhm.
Dr. Glenn. We didn't
Yeah.
get to half the things we have here.
I know. Yeah, we'll do a
Uh
part
huh.
And
2.
we want to
So,
talk about some things and
yeah.
risk factors, and we want to give out some more information. And we also have
Mhm.
these documents if you'd like. But if
Yeah.
there's going to be another caller, we would enjoy and love having someone else to
Mhm.
come on.
Yeah, make contact with her and arrange for her to call in. Or she could be
Okay.
tell her, you call me back tomorrow. Maybe we're going to arrange for her to
Okay.
be a guest. That way she can be on the video with us. We'll be broadcast
Okay.
on Suddenly Channel 23, GPAT TV.
Okay.
We'll talk about it
Okay.
after.
I'll reach out to her.
We'll talk about it tomorrow.
Okay.
I'll call you.
And so we want to say
Okay.
also to our listening audience that if you already know that you are a survivor or you know someone that's a survivor, hey, tap them on the shoulder and tell them to call in next week because we can do a part 2 and we can have more
Okay.
callers to come in and call on and just encourage. I mean, this is a very touchy subject. It's a big subject, but it's also one that can be overcame and it's something that you could be healed of and made whole.
Mhm.
And so I'm so
Mhm.
glad, Sharon, that you took the time to come by and
Mhm.
hang out with myself and Dr. Glenn. And I just want to say it's nice meeting you. And
Nice to
I'm
meet you.
glad to hear you on today. Dr. Glenn?
Yeah, I'm glad you
Mhm.
came on too, and I'm glad you were able to stay for the amount of time that you did. So I really appreciate
Mhm.
it, and we'll be talking
Thank you.
tomorrow.
Okay.
Apostle.
Thank you so much, Sharon, and you have a very
Thank
blessed
you.
day.
Nice to meet you. You too.
Nice meeting you.
Bye.
All right, all right. I'm gonna have Apostle do the last 5 minutes, which will in today's broadcast, because I have to get prepared to go out to a meeting. Apostle.
Hey, I want to let you know today, and we're grateful. First, we want to say we're grateful for our guests that just did that drop in and pop on today. And I'm grateful for you, our listening audience on today, and for this subject, because this is the first time we've had this subject on, and it was a great success today to be able to talk about Breast Cancer Awareness Month. In October, it has been happening every year. It's Breast Cancer Awareness Month. I want to challenge you, our listening audience, that if you have or you can get one, get a pink ribbon and wear it on this month in honor of Breast Cancer Awareness Month. If you've had someone that has passed away, or even if you have someone that you know that has been healed from breast cancer, wear that ribbon in honor of reminding everyone that this month is Breast Cancer Awareness Month. Hey, even wear pink. Get yourself some pink and wear it, and in honor of Breast Cancer Awareness Month. Hey, we're so glad that you came on, and we've already declared that we're going to do a part 2. We're going to talk about some of the healing methods. We're going to talk about some of the risks. We're going to talk about the next steps that you can do to take charge of your breast health, how talking and even approaching this subject, also teaching other young women and people about breast cancer awareness. I also have a relative that's very young, a very young woman who is fighting breast cancer or who has been healed from breast cancer. And she found it with just a little lump or a little nodule on her breast. So you don't think that breast cancer awareness or having breast cancer is just for older women. You could be in your 20s, you could be in your teens. You need to examine and see anything that looks suspicious, any type of cyst, any type of lump, any type of thing that is there, any difference, any discharge, or anything that is on your breast. You need to not ignore it. Get in to see the doctor and get a mammogram so you can be tested and see if that thing is cancerous. You don't want to sit and ignore something and it's in your body and it's just something that's spreading through your body. Sometimes a thing can be there and it can spread very fast and be deadly very quickly. So you want to make sure that if you have anything that is suspicious, don't just throw it away or just act like it's not there or ignore it. Pay attention to it, get in and get it checked. I don't care what it is, how small it is, even under your armpits. Get in and get it checked and make sure that the doctor has checked it out and that you've had a mammogram so you can make sure that there is no cancer in your body. Dr. Glenn?
So that you can continue to live. We want you to live forever.
Forever. Dr. Glenn, we're not going to live forever, but live a good long life, a good long healthy life is what we want you to do. You are going to live forever on the other side.
Let me rephrase it. So get your mammograms, get checked out, because when it's time for you to complete life, we don't want it to be because of some medical condition, God forbid.
And you don't want to leave here for something that you could have prevented.
That's
and
right.
So I'm going to urge you, go and get a mammogram. No matter how young you are, go get a mammogram.
Prevention is the key.
Definitely. And anything suspect, I want you to go again and get it a mammogram. Get it examined and take care of yourself. Hey, we're so glad that you came on and that you tune in to our broadcast. We're going to do part 2 next week. If the Lord says the same, we will see you right back here next week at 3 o'clock. This is the Glenn Johnson Show and Apostle Jacqueline Cullins Wiliams. I love you, and we'll see you next week. Dr. Glenn?
I'm so glad and grateful that my sister-in-law, Miss Sharon, had the opportunity to call with her amazing story, and she has been touched by an angel. I know that from the bottom of my heart. So God bless you, Sharon. Thank you for calling today. We really appreciate it. Apostle will end the broadcast at this time.
Hey, we'll see you back here next week with a part 2. We know you're expecting, and we ask that you be blessed. We pray that you're kept, and we'll see you right back here on the Glenn Johnson Show, right here on Awesome Radio. Be blessed.